blood sugar. All right, so before we get into the 7 warning signs, I want to break this down into 4 categories. The reason why it's so important to understand these 4 categories is because once you understand how high glucose and high insulin affects the body, you'll be able to understand why this is such an issue, but also you'll be able to understand your signs and symptoms so much better. The first category is compromised blood flow. And so when we're talking about compromised blood flow, what you have to understand about high glucose is that this is going to increase the viscosity of the blood. Now, we're talking about viscosity of any type of fluid. This deals with the actual thickness. And so you can kind of picture this as being water versus syrup or molasses, because that is really thick. So when we're talking about something like water, we understand that water moves around easy. It's very fluid. That would be considered to have a low viscosity. There's less particles in that water. However, when we look at something like syrup or molasses, that is very high in viscosity because it's very thick. And so when that syrup or molasses moves around, it's very thick, it's very slow, and it's very sludgy. So when it comes to high glucose, you need to understand that high glucose means that your blood is going to have a high viscosity, meaning that your blood is going to be harder to move around the arteries and the blood vessels that you have. In addition to that, this is going to make it harder for your body to deliver that blood to where it needs to go. And once again, you can kind of picture that as using a glass of water with a straw and drinking from that straw. It's going to be pretty easy to move that water up the straw. However, if you have a glass of syrup or molasses and you're trying to suck it through that straw, it's going to take a lot of work and you're going to be exhausted and it's going to move very slow. Now, can you do it? Yes, but it won't be efficient. Next, high glucose decreases the functioning of your immune system. It's said that on average, high glucose decreases the functionality of your immune system for about 4 hours, which means that it's going to decrease the white blood cells and what we call the phagocytes. Once this happens, your immune system is going to decrease and your body won't be able to defend itself as effectively as it would if your blood sugar levels were normal. Next, now, you all know that high glucose increases the insulin. You all know that because you watched my other video called Insulin Resistance Explained. Now, because we all know that high glucose increases the insulin and causes high insulin, I want you all to picture having a mixture of high glucose and high insulin as being something like a scouring pad. So back in the days when I was a kid, my sister used to force me to do her chores around the house, and one of her chores was washing the dishes. Now, in order to scrub the pot, we used to use a scouring pad, and this scouring pad is something that's very hard and it's rough, and I would scrape it around the pot in order to get everything out of the pot. What I need you to visualize is high insulin levels being something like the scouring pad. If you took a scouring pad and you brushed it against your skin, what you're going to see is you're going to have like little lines. And eventually, if you continue doing that, you're going to actually cut your skin. You're going to cause an abrasion. Well, if you do that, what's going to happen? This is going to mount an inflammatory response. Once again, inflammation is not a disease. This is part of the healing process. So your body's going to mount an inflammatory response. This is going to increase the blood flow in this area. There's going to be some edema, or what we call swelling. This is going to allow the white blood cells and everything else to come to that area in order to heal it. Once that healing process starts, you're going to see your blood get thicker. It's going to increase the viscosity. Your blood is going to start to clot on that cut, which eventually will become a scab. Now I want you to flip it and reverse it, and let's go inside the body. Understand that when you have chronic levels of high insulin and high glucose, this is just like taking a scouring pad and brushing against your arteries, your blood vessels. Your body's going to try to heal it, but over time, this healing process is going to cause more problems because this high level of glucose and insulin is not something that should be sustained. Once this starts to happen, we're going to now take the arteries from being this wide, or the blood vessels from being this wide. When that inflammation starts, you're going to get less area for the blood to flow. This ultimately is going to compromise the blood flow to your trillions of cells. And this overall leads to your circulation all over your body being compromised. And the last category is fluid disruption. So when you have high glucose, once again, you have a lot of particles. The viscosity is going to be higher in the bloodstream. With this high amount of glucose in the bloodstream, this is going to increase what we call the tone of the fluid, tonicity. This means that there's more particles in that fluid versus what's in the cells. And because of that increase in the tonicity, This is going to force the cells to release the water that they already have in your cells in order to dilute the blood sugar. This is something the body doesn't necessarily want to do, but it will if it has to. And so having high sugar in your bloodstream is going to cause the water inside the cells to now come out into the bloodstream, leaving the cells dehydrated. All right, so just a quick recap on those 4 categories. We're talking about compromised blood flow, decreased immunity, inflammation, and fluid disruption. So now that we've covered those 4 categories, let's go into the 7 warning signs that you might be diabetic.